What to know before your diverticulitis colonoscopy. If you're preparing for a colonoscopy related to diverticulitis, there are important facts to keep in mind to ensure your safety and the best possible results. First, timing is crucial. You should plan to have the colonoscopy after your diverticulitis has fully resolved, usually waiting at least 6 to 8 weeks after your symptoms disappear. Doing it too soon during an active flare-up can increase risks and make the exam less effective because inflammation can obscure your view and raise the chance of complications. Waiting allows the inflammation to settle, making the procedure safer and more accurate. The main purpose of the colonoscopy is to confirm whether diverticulitis is the cause of your symptoms and to rule out other conditions like colon cancer, especially if you haven't had a recent colonoscopy of good quality. It also helps to evaluate how extensive your diverticular disease is and to check for any complications such as strictures or bleeding. The results guide your healthcare provider in deciding whether you need further treatment or surgery. Preparation is key for a successful colonoscopy. You will need to follow a clear liquid diet for 1 day before the procedure. This means avoiding solid foods and sticking to things like broth, clear juices, and water. You should also avoid nuts, seeds, popcorn, corn, and peas for about a week beforehand because these can leave residue in your colon, making the exam more difficult. Your doctor will prescribe laxatives, often a combination of Dulcolax tablets and polyethylene glycol solutions like Miralax, to thoroughly clean your bowel. It's important to follow these instructions carefully and avoid certain medications, such as iron supplements, aspirin, or non-steroidal anti-inflammatory drugs, unless your doctor advises otherwise. Tell your doctor about all medications you are taking, especially blood thinners, as they might need to be adjusted before the procedure. If you have diabetes, you will receive specific instructions on managing your medication around the time of the colonoscopy. Also, disclose any allergies or previous reactions to sedation so your healthcare team can plan accordingly. During the procedure, which usually lasts about 30 minutes, you will be given sedation or anesthesia to help you relax and minimize discomfort. The doctor will insert a flexible tube called a colonoscope into your rectum and guide it through your colon. To improve visibility, the colon is gently inflated with carbon dioxide gas, which might cause some mild pressure or gas discomfort. While colonoscopy is generally safe, it does carry small risks such as bleeding or, rarely, perforation of the colon. These risks can be slightly higher in people with diverticular disease. However, the benefits are significant. The procedure allows for accurate diagnosis, detection of any complications, and helps prevent misdiagnosis of more serious conditions. After the procedure, you will need someone to drive you home because of the sedative effects. Recovery from sedation can take several hours, so plan to rest and avoid strenuous activity for the rest of the day. Follow your doctor's instructions carefully, especially regarding any findings or next steps. In summary, make sure your diverticulitis has fully resolved before scheduling your colonoscopy. Follow your bowel prep instructions precisely, inform your healthcare team about all medications and health conditions, and plan for post-procedure rest. Always discuss any questions or concerns with your doctor to ensure your safety and to get the most accurate results. Remember, personalized medical advice from your healthcare provider is essential for your health journey.